Well, hello, friends. Welcome to Where's Wilmington. I can't wait to get the show started, so let's just roll. I have with me one of my favorite people, Dr. Leslee Quick. She is co-owner of Wellcare Chiropractic Center. We're going to talk about all things chiropractic as much as we can fit in this little square. So I guess the first easy question would be, why did you become a chiropractor? And you've been doing this for a little while, right?
I have. First of all, thank you so much for having me. It's wonderful to see you again. Yes, so I have been a chiropractor for 26 years.
Wow, right?
Yeah, and I've been in Wilmington for 20 years this year, actually.
Congratulations.
This is our 20th anniversary, yes, thank you.
And your husband also works with you?
He does, yes.
He's a chiropractor as well.
He
right?
is as well.
So let's clarify some of the specialties. You are more focused on what, and he is more focused on what? I'll let you tell us.
Yeah, absolutely. So we have a general care practice where we both treat all ages. However, I do specialize in, I have a high prenatal part of my practice, and pediatrics, a lot of children and babies, and my husband tends to focus more on sports injuries, extremity issues, disc issues, but we both, there's obviously some overlap in there, but we tend to go in those directions.
Sure. So let me ask you an off-track question. When you guys go to dinner, do you talk about chiropractic stuff all the time?
Not necessarily chiropractic. We talk about work way too much,
right.
but
it's nice that you can work with someone you love.
But yeah, we definitely have conversations about cases that we're working on and our patients that we're discussing. So yes, absolutely. You can't help but get away from it.
And new modalities and things that you both see.
Yes.
Tell us a little more before we get into the depth of all this about your practice, what we might see there. I know you have a holistic approach and a wellness approach too.
Yes.
So it's not just chiropractic, which would be more than enough. But tell us a little bit more about what your practice has to offer.
So my practice consists of my husband and I, of course, 2 doctors on staff, and then we have a massage therapist, Jen Hogan. She's amazing. And we have Julie Kapala-Egan, who is a specialist in breath work. She's a Reiki master, and she's also certified acutonic specialist, which is acutonics is a needleless form of, think of it like acupuncture without the needles.
Ooh, I love that.
Yeah, what it does instead is it utilizes specific vibrations through tuning forks, and it uses the vibrations to go into the points where needles would typically go to elicit the same response.
Okay, so prenatal, I certainly understand. But children can go to a chiropractor, and how do we know they need it, and why do they need it, and
absolutely
give me it all.
So, give you an example. Both my daughters, who are now 22 and just turned 19 yesterday, they've been chiropractic patients since birth. So basically, the reason why children, it's really, I don't want to say it's, it's important for children in the fact, especially with children who've had difficult childbirth, because there's lots of different things that can happen with babies coming out of the birth canal that can create issues. Okay. So basically with chiropractic in general, the basis of what we do is we work on what's called subluxations, okay?
Yes.
Subluxations are misalignments in the spine. When misalignments occur, they can occur at any age, and with babies and children, let's start with babies. So with babies, difficult birth, babies who tend to be colicky, have gas, constipation issues. That's a lot of what I see. And sometimes one of the first questions I'll ask the patient's parent is, how is the childbirth? Those are all questions that I ask. How, was it a C-section? Were there forceps used? Suction, things like that.
Was it breech? All these
was it breech?
things,
Yes.
Right?
So I have a high, like I said, prenatal practice, and then I treat a lot of babies. Most of the time, more of my families that are wellness oriented, they'll bring their children and babies in for checkups just to see how's everything going. I just want to make sure everything's good. And then a lot of what I also see is, I want to say probably I see a lot of ear infections. I see,
Really?
Yep, a lot of ear infections. I see a lot of babies who are having difficulty with constipation due to one reason or another. Just the other day, I had a baby in the practice that I was seeing and hadn't gone to the bathroom in 3 or 4 days. And as soon as I started moving the sacrum,
Wow.
Yep.
How does chiropractic care help that?
It's all based on the nervous system. Okay, so whenever I describe it to patients, the best way to describe it is like this, okay? So you have the brain, which is basically the central area for all the kind of, it's like Boston. Think of it like Boston, okay? Here's Boston, and as you go through, you're going down 93, okay? Let's say 93 is the spinal cord, okay?
Okay.
Nerves come off, or like exits, okay?
Love it.
You have traffic, it's going to impede that exit. The nervous system is much the same way. So anything that's misaligned, anything that causes any irritation to that, think of it like the traffic coming off of 93.
Sure.
So what happens when that occurs is that the nervous flow, which provides nutrients, information to its endpoint, whether it be a muscle or an organ, gets impeded upon. So I'll use an adult as an example. So one of the most common issues that we see a lot of times with patients with disc injuries in the lower lumbar area, one of their biggest complaints is constipation, besides the pain, of course.
Right.
Constipation. Why is that? Because the nervous flow from L5, which is the most commonly irritated disc level, tends to control the bowels.
Okay.
The lower bowels. So that's why a lot of times with infants especially, if when they're coming out of the womb, there's any issues, or I'll double check the sacrum, usually it's a sacral issue. You get a little bit of movement in there, and the nervous flow starts to really, with babies especially, it happens like that.
Interesting.
And so that's why it's very, very typical for me to be working on a baby and quickly turn things around.
So you said that folks who are already in the holistic realm or are open to that idea, they're going to know to come see you.
Yeah.
What about those of us who, traditional medicine, I don't know how often I wouldn't think of a chiropractor for a baby. I'm sure it's safe, and I know you well enough to know it would be safe. But how is the world changing such that this is now an option, especially for children?
Well, I think part of it is, I mean, we as chiropractors have known, I mean, even if you think back to even the Hippocratic Oath, Hippocrates was the first person to say, look to the spine as the source of disease.
Wow.
So, even back then, they knew that. But we've become this, and we've become so ingrained in the medical, you take an Advil for a headache. Well, what's causing that headache? It's not the lack of Advil.
Right.
So I think we're so, I don't want to say medically trained, but a lot of us tend to go directly towards that we don't think that, believe it or not, a lot of the world doesn't, has a more holistic approach.
I was just going to say, is that cultural
Absolutely.
to us here in this country, and maybe Britain too, I don't know. Other cultures are more open to the holistic concept, would you say?
Yes, more, and even different. I've practiced up in Cape Ann for a little while, and they have a much more holistic attitude than just the Boston, the Boston or suburban Boston area. So yes, the answer to that is there is a cultural difference, I think, that makes people go in one direction versus another. I think what people are seeing and parents are seeing nowadays is they don't want to have their little, beautiful infants of, bundles of joy necessarily being, bombarded with medications all the time. So, I do find, one of my closest friends who you've had before is a primary care, and she's very, she's the mix, she's holistic, and she uses a blend of Western and Eastern medicine. And I think that parents nowadays are seeing that, wow, this person is using, this practitioner is using their hands, and they're making changes, and my child is not needing to take a child laxative to get the same results.
Okay, so let's be clear. We're not saying don't go to traditional medicine.
No,
we're
never.
saying this is an option.
Absolutely, yes.
So then my next question, obvious one, would be, is it too late sometimes when people come to see you? I think you're going to see most adults when they're in chronic pain and you're nodding because they've exhausted every resource, and you're the last on the list, not you, but your modality, your practice. So should we go earlier? Could you, I don't know, what do you think about that? Because by the time you see people, I had an aunt who went to a chiropractor. She had severe sciatica, and that was the only thing that alleviated. She had surgeries, and we could go on for days about that kind of stuff. And I am not saying medicine is not a good idea, Western medicine, but I am saying by the time some folks get to you.
Yeah. So so I'll use myself as an example. Okay. I started. What got me into chiropractic in the first place was my father had seen a chiropractor for years for migraines years ago. My mother had already, by the time I became a chiropractor, my mother had already had, I believe, 2 back surgeries.
Wow.
And I started having my own issues, knee, back, digestive issues as a young teen. And as soon as I started having those issues, she said, "You are not going down my route. You are going straight away to the chiropractor." And so that was what happened with me. Was not only was my back pain getting better. I mean, I was a 14, 15-year-old who basically couldn't move for a couple of days.
Wow.
So turns out I had a flatter spine. I basically had the same issues my mom had, and I would have gone down that route. Okay. So not only was my back pain getting better, but my knee pain was getting better, and she wasn't even treating my knee.
Wow. Because it's alignment.
It's alignment.
You know what's that nursery rhyme? The chin bone's connected to the...
absolutely.
It is true, right? Everything has to be...
Yep, absolutely.
Copacetic.
So my knee pain got better, and my everything just was feeling better. And that was my first, that was when I said, this is what I want to do. I want to be able to help people, and I was never somebody who wanted to, I always fought taking anything unless I absolutely had to. And so it was something where I could help heal without the use of medications.
Okay. So your practice also focuses on, we talked about it before, a holistic approach. You talk about weight loss in there too.
Yes.
Carrying weight. And we talked before we got on the show a little bit about how your head, can you give that example you gave about how heavy your head is on this little tiny thing that's called a spine that I don't think a lot of us think about until we have to.
No, a lot of people don't. And the best way I liken it to patients who have injuries such as motor vehicle accidents or anything like that. I always tell people, or even just sitting at the office at work with your head going. I was
going to talk to you about that. The phone scrolling thing.
Yeah, horrible,
it's
horrible.
Not good.
It's not.
We all do it.
Absolutely. But, Sitting can take. They call sitting the new smoking, by the way. Mm-hmm.
Oh, no.
Takes years off your life. Bad posture does.
Wow.
So I'm sorry.
No, that's fine. That's probably why they have those standing desks now.
Yes.
But is there a problem with standing too long too?
It depends. There can be, absolutely. Okay. But to kind of go back, I'm sorry, I didn't fully answer your question.
So about the head and...
Yeah, so think of it like your head is like a bowling ball sitting on, and I say a toothpick, but I say think of your head sitting on a toothpick attached by elastics, okay? And that's basically, your head has got 16 pounds of weight on it. Add to that, if you have bad posture and your head's going forward, that could be 24 pounds, more weight. The more your head is not in balance with the rest of your body, the more weight pressure to it. So could be even heavier.
It's posture, and some of us ladies are enhanced, shall we say?
Yeah.
So that's more weight. Right?
Absolutely.
And then also hydration. Huge, right?
Hydration is huge because...
But I don't think we think about that.
No, people don't think about it. Very often people don't. We're very dehydrated, I think. It's, your body should be, I think it's like 64, 65% water. Right. So of course you have to, take that in. And I get people who say, I'll drink 3 cups a day, if that.
Right.
And
then we all think it's our Diet Pepsis or our Gatorades or our, nothing against any of those drinks. But,
in moderation.
Yes, but, I think we all think, we're drinking stuff, so it's okay, but it's probably not.
No, it's not. I mean, because drinking, let's say, a cup of coffee or whatever, but you start drinking a lot of caffeine,
right?
That excretes, that becomes a diuretic. Think about drinking soda. Soda, not the caffeine, but the carbonation in soda, because of the phosphoric acid in soda.
Yes.
If you drink a lot of soda over time, it'll actually leach your body of the calcium because your body wants to have a very specific calcium phosphorus balance.
Right.
And so if you have too much phosphoric acid and phosphorus in your body, it can actually leach the bones of the calcium.
Oh my gosh.
So another
wow.
reason not to drink a lot of soda.
All right. Well, I'm glad I don't do that. But I do have some Red Bull and other energy drinks. But we'll talk about that after, and you can smack my hand. Okay. So when somebody first comes to see you, whether it's a parent bringing a child or it's just me, what do we need to know? What should we wear? Do we need to bring x-rays? What does a situation where we meet you for the first time look like if we're not in pain? I assume if someone is really in an emergency situation, that's a whole different situation. But the garden variety, come visit and see what. How does that work?
we have the gamut. I mean, obviously, if somebody's coming for wellness, they're not going to necessarily need X-rays. We do not X-ray every patient. I do not X-ray. We do not. My husband and I do not X-ray every patient. Some doctors do. There is a benefit to some of that. I just feel like I don't necessarily, it's not going to necessarily change my treatment for you. If I feel like it will possibly, then yes. Or if I feel like there's something that is important, then yes, absolutely. I probably send out about 30-40% of patients for X-rays or MRIs.
So how do you diagnose? Is it just by feel? How do you?
So no, there's a mix. So there's depending on the patient. Okay. We might do some neurological testing. We call them MRSs, motor reflex sensory is most common for a lot of cervical and lumbar. Cervical is neck, lumbar is low back. Okay. So we'll do some nerve tests. We'll do some orthopedic tests. I look at posture, I look at range of motion, and then depending on your history, depending on what brought you in to see me, I may recommend X-rays. Usually X-rays, only because, truth be told, MRIs are hard to get at the very beginning, and insurances are getting more difficult about people getting MRIs, so I'll typically start with an X-ray, even though I may want to start with an MRI first, but sometimes it can be difficult to get the MRI right off the bat.
So I come to visit you, I want to be wearing comfortable stuff.
Yes.
This is not about looking like
No.
all that. You want to come as comfortable as possible.
Absolutely.
Right?
Yep. Absolutely.
Okay.
I mean, we do, if patients don't have the correct clothing, it's too restrictive, we have patient gowns for people if they need it. But typically, most people will come with, sweatpants or comfortable clothing for the most part.
And do we call what you do adjustments or treatment, or is it what's the nomenclature?
So the basis and pretty much the largest piece of the component that we use with our patients is the chiropractic adjustment. Yes. Okay. And that is where we palpate the spine, and we'll palpate other joints. I mean, I adjust feet, we adjust shoulders, you can adjust pretty much every joint of the body, almost. So basically what we do is we start with palpation, where I'm feeling for the mobility and motion within a joint. Right. And then if I feel a lack of mobility in that space, then what I will do is I will find which direction it needs to move. And the adjustment is moving it in the proper direction.
I see. So note taking is going to be huge here.
Oh, yes.
Because I'm guessing the first time I come, I may not have the range of motion that you're going to help me get from all the things you recommend and from also the adjustments and treatment that you do.
Absolutely. Range of motion is very important.
And the patient probably has some help to do there because stretching?
So most patients get exercises before they leave my office. So if I have a patient that I feel, I'm very honest, I believe that my patients are very honest with me, and I'm very honest with my patients, and I'll tell them, I call it their homework. Right. I'm like, this is a big part of what you need to do to help fix your issues. If you don't do your exercise, if you don't come in for your appointments, that's all going to impede upon your progress. Right. So not all my patients get exercises before they leave as something to do with, to help that range of motion or strengthening. Usually we start with stretching, and then we turn over to correction and strength afterwards. Right. And if I find a patient if either there's exercises that I cannot give to them, or if I feel like they need more one-on-one, then I'll recommend physical therapy, either as a co-treatment or separate, depending on what their needs are.
I think it's nice, as if I were going to be your patient, that I have some role in my own health and treatment. I'm not just coming to you and you're fixing me up and I'm running off. I kind of like the idea that I'm part of the process, which is a little bit different than some other medical treatments somebody might have. You know what I mean? Definitely. I'm more invested in my own process that way.
Well, absolutely, because one of the things I will you get to know your patients. I have had some patients who've been with us pretty much since the beginning. I have patients who come in, they're like, get me feeling better, and then I'm like, so I always ask, what is your goal? Are you looking to just feel better? Are you looking to maintain what the work we've done? We get the gamut of people, and I always tell the people that do that I'll end up, I'll be like, okay, I'll probably see you in another 6 months, and we'll start over, depending on the person.
Right.
But what your goal is, what you want out of the treatment, we try to work with you to get that. Of course, my ultimate goal for everybody is always wellness.
Right, of course.
So I will always say, this is my recommendation. You take what you will.
Take what resonates and do what you can do.
Yeah.
Right? Okay. So here's some questions I have. Migraines.
Yes.
Tell me.
Migraines.
I would not think of although we talked about the head, but really? Chiropractic care for migraines.
Yes, and again, part of it is the neurological component, but a lot of migraines, there's also what we call a cervicogenic component, meaning that there is cervicogenic headache, but migraines have a cervicogenic component sometimes. Not all the time. There are migraines there are different headaches that sometimes, I will always say that depending on what is creating this depends on how much I'll be able to help you, like a vertigo or something like that. Yeah. But we do find a lot of times when people come to me with certain problems, I'll note, okay, I notice you also have headaches. I notice you've been having migraines since you were 14 or something to that effect. And I'll say, don't be surprised if your headaches reduce in frequency or severity, and very often they will.
Wow, amazing.
I don't necessarily say I get rid of migraines. Right. It's your body helping to heal itself.
If you can make it manageable, some people, it's really chronic and it's very uncomfortable.
Yes.
Scoliosis, everybody's favorite. Do we still talk about that? Is it still a thing?
We do. No, absolutely. I mean, for a couple of reasons. So I try not to freak people out in my office, because sometimes you have any deviation from normal. So if I was to look at a person from front to back, they should look straight, okay? Any deviation from normal is considered a scoliosis. But, however, it could be minimal. So I haven't x-rayed myself in years, but I had a minor deviation or a scoliosis. So minor. If it's under 10 degrees with people, I really don't even, I'll mention it, but I won't say the word scoliosis.
It's such a scary word.
Because people do get freaked out by it. I'm like, it's just a little off. Now, sometimes the scoliosis is caused by an imbalance in the pelvis and in the sacrum. So sometimes I'll tell people, I don't know how long if we don't know how long they've had the scoliosis, sometimes it can be changed just by balancing the pelvis and sacrum. You fix that.
So now I'm getting what you're saying about it has to be a wholeness, because you have to look from head to toe, literally, and every place in between.
Yep.
Because if the hip is off, the curvature looks like it's there, but it might be the hip that's causing that, right? Oh, well, look at that.
Absolutely.
Okie dokie. All right. So let's talk about the noise. Those of us who watch TikTok, there are a lot of TikTok chiropractors doing some pretty interesting stuff. And when you see them and they're palpating or they're moving around the person, the cracking noise, it's frightening to hear. We talked a little bit before we got on the air about, should there be that? What is that? What if that's not there? Let's approach that.
So every joint in our body has gases within them. Okay. When certain movements, best way I described this to you before, think of a joint like a soda can, okay? There are gases within the joint, gases within the soda can. When you open up that soda can really quickly, you hear that kind of noise.
Right.
We call that, when it happens within a joint, we call it a cavitation. Okay. And all that is just gases being expelled from the joint very quickly. Sometimes I joke.
Harmless?
Harmless, absolutely harmless, yes.
Natural, normal.
Natural, yep. And it takes 20 minutes, about 20 minutes for the gases to reincorporate back into the joint. So I could adjust the joint twice. If I feel like it's not moving enough, I might readjust it. You might not hear anything the second time because there's no gas to be released.
Interesting. So if there was no gas, is that okay? Are we supposed to
absolutely
have
fine.
gas in there?
Sometimes,
should it be there?
Sometimes I joke with patients, and I say some people are gassier than others.
Yes.
Because some people, they just make a lot of noise.
Okay.
And some people don't. And then I have patients who will say to me, I didn't hear a noise, and they feel like they didn't get an adjustment out of it.
Yeah.
Yes, they associate the noise with the adjustment. I'm like, no, makes no difference. It's the movement that matters. But because chiropractic adjustments, my type of chiropractic adjustments, there's lots of different ways to adjust. Okay. And we do use different methods of adjustments, but typically in my practice and my husband's practice, for the most part, we use our hands. And when we do a quick little movement, which should be very specific, okay? It should not be a sort of thing.
Oh.
No. That's...
You know how sometimes somebody hugs you and you get that cracky sound?
Yeah.
It's not supposed to be that?
I mean, it's not, most of the time it's harmless, but it's not, the goal of what I do is to move a specific joint or the joints, it might be a few joints, that have to move. I'm not there to move your entire thoracic spine if it doesn't need it.
Wow.
Does that make sense?
Yeah, so fascinating.
Yeah, so yes, it does not, the noise means absolutely nothing to the adjustment.
Okay.
It just, sometimes you hear it.
Okay, off track. Is that noise that you get when you crack your knuckles, which we all know
the same thing.
It is the same thing. And I never died from that.
It
So
is.
it should be okay to do.
Yes, for the most part. However, if you do it a lot,
Yes.
what will end up happening is the stretch around the joint and the ligaments. Because when we do an adjustment, there's a stretch to the ligaments.
Okay.
Bones are connected to other bones via ligaments. Muscles connect to bones via tendons.
Right.
Okay. So when I adjust a joint, there's going to be a small bit of stretch to those ligaments. On its own, fine. But if I start doing it 20, 30 times a day, what happens is those ligaments in the joints like, what's going on? Why aren't you moving me? You got to move me. And so you'll start to feel discomfort, and then sometimes it'll start to get inflamed.
Yeah, and I even noticed some people have bigger knuckles because of that.
Yeah, so I get a lot of patients, and I can usually tell when there's a patient who self-manipulates quite often.
Okay.
I can automatically
So I leave
tell.
your office probably feeling pretty good. Maybe not. Like maybe a little
Sometimes
bit
you feel sore.
uncomfy-ish, right?
Yep.
What do I do after? I know when I get a massage, they stress the water thing.
Yes.
They always say, like, it's so funny to me. You get a massage and you have to do aftercare. But it is true.
Yeah.
So what would a typical visit after I leave, what would I do to make sure I'm getting the full benefit of what you're doing?
So for the most part, generally, one of the questions I ask a lot of patients also is do you work out, do you exercise a lot? Because that'll kind of guide me into what I'm going to recommend for you.
Right.
So somebody who exercises a lot probably won't feel really sore after their first adjustment.
Right.
But if somebody was not, another question I ask is, have you been adjusted before? Because I have 56-year-olds who've never had a chiropractic adjustment.
Yes. I'll come visit after.
So anyway, what I will typically tell that person is after their first adjustment, I will say usually ice. I'll give them information about icing, about 10 to 20 minutes. You never want to ice more than 20 minutes at a time. Let the skin to return to normal temperature before you reapply. Drink a lot of water, stretch, things like that. And of course, don't, if let's say you're coming to me with, low back pain and sciatic pain, don't go to the gym that day, sort of thing.
Right, don't go
the
climb a
obvious,
mountain.
yes.
Oh, I feel so great
the
now,
obvious
right?
things,
Okay.
yeah.
That is human nature, though, to do more than we should.
Yes, oh yeah, absolutely.
Because as soon as you feel better, you think.
Yeah, but I do tell
right?
people, just kind of take it easy the first day, because you might feel think of it like a workout for your body.
Okay.
And so we just got
a few more quickie questions, because I know you have such a busy life. Side sleeping and mattresses. Oh, we could talk about that all day. But there's a lot of, I don't know if it's anecdotal or just recently, talking about side sleeping. You shouldn't do it, or maybe you should be. What do you think?
The only one I tell people not to do is stomach sleeping.
Okay.
That's a no-no. And that's because unless you live and sleep on a chiropractic table, on a chiropractic bench where your head is flat down, straight down, you're going to sleep with your head turned in one rotation direction or another. And if I walked around like this for 8 hours, this would not be good for my neck.
Right,
so,
right.
the muscles are shortened, it's an unhappy situation.
Makes me think of when your mom says if you leave your face like that, it'll stick that way.
Exactly.
Right?
Well,
Because
I'm
that's
finding
what's
that in
going to
those
happen.
wrinkles.
Because you're so cute. I don't see them. The lighting's really good in here. But meanwhile, back at the ranch, if you stay too long in one place,
Yes.
It's obvious it's going to
Yes.
affect that. So we're saying no stomach sleeping.
No stomach sleeping, side sleeping and back sleeping. I have no problems with side sleeping. The one thing, this is where the mattress does come in really important, is that there are a couple of reasons, because people will say, well, what kind of mattress should I get? And first
Right.
thing I'll look at is how curved is their spine? So, for example, I talked about me. I have a flatter spine. I work very often still. I use devices at home. I get my adjustments once a week, and I use a device at home that helps my curves in my spine, my neck and my back, my low back. If you are somebody who has what we call hyperlordosis, or a big curve in their lumbar spine, they might want a firmer mattress. Or somebody who is overweight might want a firmer mattress. So there's a lot that goes into it. If you're somebody sleeping alone and you're under 130 pounds, you don't need a firm mattress. So there's really a lot that goes into it. So I can't say like specifically what type of mattress is good for a person. It really depends on your weight, how you sleep, and it also depends on, are you a single sleeper? Do you sleep with somebody else?
Right.
So there's a lot that goes into it. But there's no issue. As long as your mattress supports your hips, there's really no issue as far as I'm concerned, as far as side sleeping, as long as everything is alignment. I always tell people, when you sleep, you want to look like when you're standing, nice, proper alignment.
Okay. So we're going to just jump right over this topic really quickly. Insurance. I think I remember when I was a kid growing up, chiropractic care wasn't covered at all.
Right.
Are we doing a little better?
Yes. The answer to that is yes. Most insurances cover chiropractic to some extent.
Okay.
I think the issue with insurance, is just in healthcare as a whole. So,
of course.
So
we're doing better than we were.
Yeah,
That's
I
all
would
I
say
wanted to touch
yes,
on.
yes,
Just
we
because
are.
I know you're sitting at home saying, why isn't she saying that?
Yes.
So I'm saying it because we're doing better than we were, but there's still work to be done.
Oh, absolutely.
Right?
Yes.
Okay, great. Tell me about shock wave therapy. And I missed the big word at the beginning.
Extracorporeal shockwave therapy.
One more time.
Extracorporeal shockwave therapy.
Okay.
So we added one of the things, because we're conservative, holistic healers, everything is natural that we do. And because of that, there are sometimes that we just can't help certain people. So my goal is to try to help everybody, right? What this has done, it has really been an amazing new technology that we just added this year. What shockwave therapy does is, and we use what's called the STEM, ours specifically is called STEM wave. It's a focused shockwave therapy. And what it does, it uses acoustic sound waves to travel into damaged tissue to help heal. It does three things. First, it brings down pain and inflammation at a rapid, accelerated rate. It also helps your body naturally recruit its own stem cells to help heal damaged tissue.
Love that.
Yep, and then it also helps to lubricate, it's called angiogenesis, lubricate to damaged joints for arthritic patients.
Now, when you said something to me earlier about tuning fork or sound, does this sound oriented, or how does this work?
It uses so it's an electrical impulse. Right? It's not laser. Nope. We used to do laser, but we've phased that out because this is just so much better.
Yeah.
What this does is it has what's called a cellular response technology. So what happens is the acoustic wave goes into the tissue, very different than acutonics. Acutonics uses vibration to go into meridian points.
Yes.
Into the body. What this does is it uses these electric sound waves to go into damaged tissue to help it heal.
Wow.
Yeah.
Have you tried it?
Oh yeah.
You like it?
That's why we got it for the practice.
Yeah.
Because my job for over, I've been in practice, been here for 20 years, but I've been in practice for 26 years. And just damage, wear and tear to our hands. I had a pretty significant ACL tear about 8 years ago in a ski accident. And the last couple of years, my knee started acting up again. I'd been doing pretty well, but then it was those two things that I said, let's try it on ourselves. And the technology is, it's shockwave therapy has been around for a bit, but it's this technology, this focused one that we have now is a newer technology.
Because I never heard of it.
Yeah.
And it sounds non-invasive.
It is. The
Which
beauty,
I like.
Yes, the beauty about this technology is there are no injections or anything like that. It's not covered by insurance because, of course, anything that's spectacular does.
We'll get there. We'll get there.
But it is a really revolutionary way for us to help patients in areas that we could not help before.
Yeah.
Our arthritic patients, I use it with my really bad disc injuries. Gosh, I want to say we use it for plantar fasciitis. We use it for nerve regeneration. We've been using it for a lot. I want to say arthritic knees, shoulder injuries are probably our two biggest.
And it's nice to have options, right?
It is nice to have options. And what I love about this technology the most, well, besides what it does, of course, people get, after 10 visits, they're feeling 80, 90% better. Grandparents are like, I can finally sit on the ground with my grandson and play games again. It's just amazing. But what I love about this treatment especially is that it's called the cellular response technology. When it goes over healthy tissue, there's also a diagnostic capacity to it because it won't tell me what is wrong, but it'll tell me where there's damage. So if somebody says, if they come to us and they say, I'm having a knee issue, I don't know what is going on.
Right. Let's
say they don't have an x-ray or an MRI to bring in. What we'll do is we'll map the area. When the sound wave goes over, when the shock wave goes over healthy tissue, you feel nothing. But as soon as it goes over inflamed or damaged tissue, the patient will start to feel the discomfort.
That is fascinating.
Yeah, it's pretty amazing.
Fascinating. All right, I could sit here and talk to you forever. I'll just do one more question, then we'll do the final thought. So you're a healer. I know that about you, and your presence gives off that aura of comfort, and I know you know that about yourself. When you go home at the end of the night, how do you take care of yourself? Because you're giving out all that energy.
Yeah, I
all day long.
I do get pretty tired, especially when we have a long day. I'm pretty pooped by the end of the day.
Yeah.
But I generally try to make sure that I take time to relax. I used to have a problem with that a long time ago, but now my kids are older. I can do that a little better.
Well, you don't have as much on your plate, or maybe different things on your plate.
Yes, different things,
before,
but I do try to make time to, I do, again, every night I'm always doing something for my own spine.
So you practice what you preach.
I absolutely practice what I preach. I get a massage. I get my massage from my massage therapist at least once a month. I get my chiropractic adjustments. I mean, my job is incredibly physical. Anybody who has a physical job, really just, you need it.
So for me, I know your job is physical, but it's also mental too, because when you're palpating, you are actually reading that person.
Yes. I mean,
I don't want to say you're psychic, but it's kind of like that.
Oh yeah.
Because you can tell.
I definitely, especially as I get to know people's bodies, I'll give you a perfect example. I remember this years ago. It's one of my favorite stories. He was probably 12, 13. I'd been seeing him for a number of years, monthly, and I was like, something's going on. You did something. No, nothing. And then I saw the mom later. It was also a patient. She said, he didn't tell you he fell over the hurdles yesterday.
Wow.
So it's, so I can typically tell if there's something, and that is also where I will also say to people, okay, I had a patient the other day, I'm like, something is going on with you. We cannot seem to control the tension. I really think that there's something, either your stress levels or something, and I feel like you need, get some breath work or acupuncture or acutonics or, something else that was not just neuromusculoskeletal in nature, because of the mind-body connection.
True.
I get to know patients, and so I can pretty quickly tell when something has changed.
And I love that you approach it from a full circle
Absolutely.
concept. You're willing to accept anything that works, equine therapy or traditional therapy or doctors or whatever. I think that's amazing that you do that. Is there anything final? We've covered the entire gambit, but we could do more, that you want to say today or share before we go?
Well, again, thank you for having me, Lisa. I really appreciate it.
Wait.
I was happy to see you.
Yes, I see you too.
Just, if you have if anybody has wants any more information about the office, you can go to our website at wellcare-center.com. You can follow us on Facebook, Instagram, our website, or always email us. Our phone number is 978-658-7700.
Beautiful. One more time with the number so we can hear it one
Oh,
more time.
sorry.
fine.
978-658-7700.
Beautiful. Thank you so much for taking
Thank
time.
you.
I feel better just talking to you. I really do. Well, thank you for watching. I hope that you are okay, and I hope your family's okay. And if you're not, you come see my friend here. I want to tell you thank you for watching. And the next time somebody asks you, where's Wilmington? You tell them right here and right here on WCTV. Hey, be well.